2024 meeting of the Burlington Board of Health to order. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Susan, are we on?
Yeah.
Okay. I'm Dr. Edward Weiner, Chairman, and with me this evening, the board members, our Vice Chair, Gail Demore, Mary Beth Welch, Andrea Sheehan, and Mara El Sabahi. Tonight also with us as professionals, Susan Luminello, who is our Director of Public Health. Our Associate Director of Public Health is Michael Green, and this evening we have our Health Agent, Marlene Johnson. As far as the recording secretary, is Ms. Fockingham online?
She's going to be doing the minutes from the recording.
Minutes from the recording, thank you very much. Please note, we are live on and will be taped by BCAT and available for appropriate comments and questions through this video technology. And as always, thank you for BCAT for what you do for this community, keeping us all aware and so well informed. Thank you so much, BCAT. First on our agenda is approval of minutes, and we have approval of minutes for August 27, 2024. We have those minutes. Your pleasure. What is a motion, please?
So moved.
We have a motion by Mary Beth Welch. Or a second?
Second.
We have a second by Ms. Sheehan. Any other discussion, errors, omissions, additions? If not, all in favor?
Aye.
Aye. 4-0-1. Thank you so much. Our next is citizens' time. Obviously, there's nobody here for citizens' time because you are all part of an agenda item. Do we have anybody online?
No.
Okay, nobody. I did get a call from the individual who spent some time with us in citizens' time. I think it was last meeting, and they were very, very happy to join in on citizens' time. Chairman's report. Well, September continues to be a very busy and interesting period for the Board of Health. We were acknowledged at the opening of the Broad Institute with both publicly and privately. Our half-day psychological first aid program attracted many members of our Medical Reserve Corps. We gave a presentation on leadership and successful meetings at a full BVRC quarterly meeting. We have started our high-dose flu vaccine clinics. We had a presence at town meeting last night. And next weekend, next Saturday at 8:30, we will have our Fall Household Hazardous Waste Day. And most interesting, so many in town continue to thank us for what we do for the community. They appreciate our programs and especially our availability, our leadership, and decision-making responsibilities. I'm amazed that so many tell me that they watch us on BCAT, where we can see them on BCAT, but also on Facebook, where some watch us anonymously. I'm always amazed how many people tell me that they watch us. Last, most important, on behalf of the board, I want to wish the Burlington Jewish community a blessed and happy New Year, and our Hindu friends for a blessed, healthy, and prosperous Diwali. Any comments? If not, we can move on. Okay. There are no subcommittee reports, are there? No. Applications, permits, which brings us to the keeping of animals on 22 County Road. Please come join us. This is Ms. Grace Tho. Is that how you pronounce it? Thu. Thank you very much. Presenting this evening for the board will be Marlene Johnson, our health agent.
Ms. Thu is here tonight from 22 County Road, and she is seeking a permit to keep animals, hens. An inspection was conducted by me on September 6th. The following were found to be in compliance with the Burlington Board of Health minimum standards for keeping of animals regulation. The chicken coop design was the proper square footage per hen, proper ventilation and setbacks were met. Manure management plan does not cause a nuisance. Turf management plan, reseeding grass if needed. Feed storage plan does not attract pests. Action by the Board of Health, the board may vote yes to approve the keeping of animals permit for hens for Grace Thoreau, 22 County Road, with the following conditions. 1, notify the Board of Health in advance before increasing the number of hens. Number 2, coop shall have adequate space for hens, at a minimum 2 square feet per hen, not including the nesting box. 3, do not purchase or acquire roosters or cockerels. 4, renew the keeping of animals permit 30 days before the expiration date. 5, allow the associate health inspector to schedule and conduct a compliance inspection. 6, this permit is approved for the applicant noted above and is non-transferable. And 7, violations of this permit may be subject to penalties as noted under Section 2.7 of the Burlington Board of Health minimum standards for keeping of animals regulation. Or the board may vote no, not to approve the keeping of animals permit.
Ms. Thu,
Yes,
why do you want chickens?
for eggs.
For eggs?
Yeah.
Have you had chickens before?
Yes,
Where, in another community?
in my country.
Oh, okay.
Yes,
And you're well aware of what you need to do. You've seen all of these
Yes.
conditions.
yes,
We have 6 notifications that were sent to abutters. So this is the first time, and the only time you need to come before us. But 6 abutters were notified. Ms. Johnson, did anybody respond to you?
No.
Director or associate director?
No.
So no, do your neighbors know that you want chickens?
yeah, I didn't know.
And they don't have any issue?
No,
Okay. Please, I open up any questions, Ms. Thu.
I'm just curious, how many are you starting with?
6.
6. Thank you.
6.
Yeah,
Anybody else with questions? No butter. Does anyone have any? Would someone like to make a motion?
so moved.
Okay, we have a motion by Ms. Welch, second by? Second by Ms. Demore. Anything else? Any other comments? All in favor?
Aye.
500. You're all set. You will receive something from our health agent, correct? Thank you.
Thank
you
you
for
so
coming.
much.
It was easy, wasn't it?
It was.
Next will be a variance for Cho-Cho Hot Pot, 75 Middlesex Turnpike, external grease interceptor. And gentlemen, would you like to come up here? Do we have something to sign in? Them to sign in?
I don't know.
We will do that. We're going to need you just to sign in, print your names, please. This is for our records that you were here, and for the recording secretary who'll be doing the minutes remotely. Your name, please, first,
Sai-Ho Lau.
okay? And you are?
My name is Jim Chen. I'm the architect.
You are the architect.
Yes.
So representatives are before you tonight to request a variance from the Burlington Board of Health's local regulation that requires the installation of an external grease interceptor. They're going in at the Burlington Mall. The application is attached to the paperwork, and their menu is also attached to the paperwork. So the action by the Board of Health to vote yes to approve the variance from Section 2.3, Part A, and allow the new food service establishment to operate without installing an external grease interceptor with the following condition. The food service establishment operator and the property owner both understand that this variance may be subject to revocation, suspension, or expiration as determined by the Board of Health. A variance under these regulations may be revoked, modified, or suspended only after the food establishment has been notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for revocation, modification, or suspension of a variance include, but are not limited to, a determination that the food service establishment is discharging grease in quantities sufficient to cause sanitary sewer line blockages or increase maintenance of sewer lines, or the board may vote no, not to approve the variance.
I have one quick question. The applicant is the architect here, but does actually the variance go from the architect or to the owner?
It's going to go to Tony. He represents Cho Hot Pot.
Okay, so it'll be on the variance, it'll
On
be
the
Tony.
owner. So it'll be for the ownership,
Tony,
yes.
how do you spell your last name?
Lau, L-A-U.
L-A-O.
L-A-U.
L-A-U.
Yes.
Okay. So does Mr. Chen, you were going to present something?
Yes, I'll do a quick presentation.
Okay,
So first of
please.
all, good evening, Mr. Chairman, members of the board.
Thank you.
Again, my name is Jim Chen. I'm the architect representing Cho Hot Pot Restaurant, located at 75 Middlesex Turnpike, which is inside of Burlington Mall. This space used to be a place for Johnny Rocket restaurant, used to be.
Oh, okay.
So we're here tonight before the board requesting for a variance under Board of Health Regulation, Section 2.3, facility requiring grease trap, Part A. So our plan is to install a suitable size internal grease trap and request for a variance from installing an external grease trap. There will be a tremendous hardship since we're inside a mall and the exterior space for an external interceptor is very limited. So before me, we have a proposed floor plan. We can talk more about it, of the proposed Cho Hot Pot restaurant. It's approximately 5,000 square feet with 140 dining seatings. The kitchen area is approximately 1,800 square feet. And we did a thorough calculation of all the fixtures that would be tied into the grease trap, including 3-compartment wash sink, the prep sink, the hand sinks, mop sinks, dishwashers, and all the floor drains.
Excuse me for just a sec. Did you say all those are going to be tied in?
All those will be on.
So you need to follow the state plumbing code?
Okay.
Because not all those are to be tied in.
Typically, we tied in dishwashers, 3 compartments.
Dishwasher, yes. Yep, the 3-compartment sink, yes.
And-
But just double check with the plumbing and the plumbing inspector
Plumbing code,
from the,
okay.
right, because some of those are not. The hand
Typically,
washers not.
we don't tie it in the hand
So,
sinks.
yes, you want to make sure that you are going to be able to pass their inspection,
Right.
so, okay,
Okay.
thank
Ms.
you.
Johnson misses nothing.
And then we came up with a calculation of 195 gallons per minute, which a lot of it, including some of the closing hours usage for floor drains and mop sinks. So we recommended using a brand called Watt GI 250K interior grease trap, which is about 52 by 42 by 34 in width, 42 inch in depth, which will be located inside the kitchen portion for ease of regular cleaning. So the model would provide is a 500-pound capacity at 250 gallons per minute, which is well over the maximum usage of 195 gallons per minute. So the grease trap maintenance will be on a regular cleaning schedule. The cleaning company will clean and maintain the grease trap every 2 months, or a what we call a 1/4 full rule, which stipulates that the staff should clean the grease trap when it's 1/4 full.
How would you know that?
You can look into it, open it up and inspect it on a regular basis. So by doing so, this will prevent foul odors in the kitchen and reduce the risk of clogged pipes, and also extend the life of the sinks. Also, in addition, the manager will also train their staff on removing residual grease with paper towel before going into the dishwasher or sink. This will help keep the grease from going down the drains. So this concludes my presentation, and I hope the board will consider this. I'll propose to use an internal grease interceptor and exempt from the requirement of an external grease trap. Thank you.
Would anyone like to, please?
Marlene, looking at the menu, it is low volume grease?
We have measures in place, so
That's what I
if there's a
thought.
problem, they're at the Burlington Mall.
Yep.
It's an existing establishment,
Right.
so the mall's been really good with all the brand-new facilities. They were able to put in external grease interceptors way back when they acquired Sears and the 85 Middlesex Turnpike, but some of these older restaurants are not able to do that. As long as their internal grease interceptor, which he has a plan, which I'm happy to hear, is going to be serviced on a regular basis, and he even mentioned that staff will be trained not to dump any grease down the drain, to try and use paper towels and get it into the trash versus down the drain. Most likely, you're not going to have any issues.
Thank
So,
you.
Thank
You're
you.
welcome.
Anybody else like a question?
Did the prior restaurant have an internal?
They did not an outside one, no. And
They had it inside?
They had inside. Yes, all the restaurants are required to have an inside, but yes.
So I have a couple of questions. First, and I know you referred to it, the reason to have a grease trap is to keep the grease from going into the sanitary sewer and not clog the pipes. That's what we really,
That's correct.
you
yes.
know, I know you want to keep the odor down, but really the reason we need, and you need to keep logs. Are you familiar with that?
Yes.
You need to logs, and if, when they come in to do an inspection, if Ms. Johnson comes in and there's no log written, you will have problems, real problems.
So when the inspector comes in to do a routine inspection, that's one of the things that they're going to ask for, is to see the log, which shows how often it's been serviced. So we'll go over all that once we get closer to your opening, so.
Now, would you describe Chocho Hot Pot? This is an advertisement for you. Well, what type of food is it?
So it's a Chinese hot pot style where individual will have their own pot of broth of their liking in front of them, and then they get to choose the type of meat and vegetable that they like, and then they can cook it in front of in front of the tables for them. So it's very great for gatherings, for families and friends, especially Boston does get really cold, so a hot pot is a very great place to gather and keep everybody warm.
Now, it says all you can eat, is that correct?
It is all you can eat, yes.
So what happens if, when you make your pot afterwards, you'll bring more if people ask for more?
Say that one more time.
How do you make it all you can eat?
Oh, so the items, so the meat are sliced on order, and then we have other items like vegetable and other certain item that can be taken at the market table, we call it, similar to Fogo de Chao's market table style, where you can go up and choose the item that you like.
Very good, thank you. Any questions? I've eaten Chinese food in 18 countries, so I will be the first person on.
You'll be welcome.
And if there's nothing else, do I have a motion?
So moved.
I have a motion by Ms. Welch, second by
Second.
Ms. Demore. Any discussion, any more questions? Any of our professionals have anything to say? If not, all in favor? Aye. 500. Welcome to Burlington.
Thank you.
Thank you. Okay. Staff reports. Now, our environmental engineer is not here this evening. I'll ask the board what they would like. Would they like to postpone her report and we can double that up at the next meeting? Or do you have questions that maybe our director or associate director of public health can answer? What would you like to do? I have no.
I think Susan and Mike can answer any, I mean, that's my opinion, just as if, same if we're looking at the nurse or the associate.
Okay,
Health, we have.
so the environmental
stuff.
engineer,
I agree.
okay. Any questions for the director of public health around the environmental engineer's report?
I have a question, it's okay.
Sure.
It did have to do with the mosquito spraying, which mosquito spraying isn't really on the topic, but her report on mosquitoes. And I don't know if it's appropriate to bring up the discussion now, but can we have a discussion about possibly offering more to the town through the mosquito spraying program?
So, that's up to the board, every year when we do the budget, as far as what the services they want for that upcoming year. So for this year, we've already, your board approved it for
Right.
a certain amount of money and a certain level of services, which currently this year it includes the helicopter larviciding in the Vine Brook area. That's like a one-time thing where they do that. Larviciding in the catch basins, which they do in the summertime. They drop these little thing called dunks in the catch basins so the mosquitoes can't breed in the catch basins. And then they do the surveillance and the truck mounted spraying. So that's what we get now. And the truck mounted spraying occurs dependent upon surveillance, what comes out during the surveillance. If the mosquito population is high in a certain area, according to the surveillance, then they'll do the truck mounted spraying there. So next year, if that's something that the board wants to look at, we certainly can, as far as you want to spend more money, ask town meeting for more money for mosquito services, and then what are those services that you're asking for? What more would you want?
So to follow up on maybe Gail having that discussion, you're saying you do a survey after the spray or testing of, how do we know what we've done for this year is adequate for next year? How do we
Those are
know?
the services that we get. The Mosquito Control Commission is the one that does the surveillance.
Okay,
So they
have traps, and they trap the mosquitoes, and basically they count them
okay.
all summer long.
So we'll have that data before we do the next year's budget?
They don't really give us any data. They just kind of say, during the whole year, they'll say, we saw, increased population in this trap. We want to do truck mounted spraying here. That's basically, they don't say, I suppose we could say, how many truck mounted sprayings did you do throughout the whole year?
If we want to increase it, we kind of have to have data of.
Well, I guess, could we get pricing
You can get
on
pricing,
different
yeah.
things? Okay, so like,
You could get pricing.
just to give choices to,
And you really is like, you can't say, well, I want to increase the amount of truck mounted spraying, because they're not going to do that unless they need to do it, right?
correct, but I didn't know if they offered more. Like, I've heard of other towns allowing certain number of individual sprays per yard or in the town or something like that.
They don't do it on private property.
Okay.
They
They don't
only-
offer it at all?
Right, no, they do it like along the streets. They won't do it in someone's home or something like that.
Okay.
Yeah.
Could we get pricing to see?
Usually when the time comes, you can say, they'll offer us some, this is the cost for this is the services that you've been getting in the past, this is the current cost for that. Now, if you want to increase services, what services would you increase is kind of the question. That's what we'd have to ask
I
them.
guess that's what I'm
How would we
wondering.
know we want to increase
Do they
the
offer
data?
more services and what are they?
I'm not sure what data what you're looking for, that's the only thing. We could
Well,
have.
is it based on, like, if there's a higher risk, we can't add in the year, we can only, because we budgeted for this year. So let's just say next year, we've already have our budget, but we can't add to that budget if it shows there's a high population and we want to spray more?
No, no.
No,
I-
because that's really not how mosquito control
It's not,
works.
so they have
It's-
traps around.
Yeah, and also too, it's like a pool. So the East Middlesex Mosquito Control Commission
Yeah,
services a certain area, and these are the towns that it services. And basically what we do is we pay into this pool of money that they use to provide these services to that area. So if, for example, a neighboring town, has more, or we have more mosquitoes in one year, even if we didn't pay for it, they're gonna provide
they're
it.
gonna provide it. Okay.
And vice versa for another town, because it's all pooled, because there's no way to predict how much mosquitoes are gonna be in
No.
one area in any one year.
Nope.
Is there a way to increase the number of traps within town? Because there's been so much, like, development and building. My feeling, and some other people have asked, if some of the traps have been in the same place for so long, are they collecting correct data?
So with that, I think what we'd have to do is have somebody from East Middlesex Mosquito Control come here and explain to you how they do that. Because I don't think myself or Christine can answer that question.
Okay, that's fair.
Because they have an entomologist on staff who studies mosquitoes and
Right.
has set those traps for certain reasons, and they keep them in place for certain, they have their reasons for doing it.
Right,
I mean, it's
Yeah,
my
to the
understanding there's a
agenda.
trap in my neighborhood, but it's been there for 40 years. I don't believe it's in an accurate spot to collect mosquitoes.
So that's a
I'm
great
just
issue
curious,
that you
Yeah,
brought up.
I can't say if it
Can
is,
we-
because I'm
can-
not.
we haven't had
It's not my expertise.
East and Middlesex mosquito.
I can certainly,
We
yeah.
have not had them here. I remember the former commissioner, I can't remember his name,
Dave Henley.
Dave Henley, who was here 15, 18 years ago, maybe 20 years ago.
Yeah.
It would be nice to have him come down.
Just
He's
wondering.
retired, but we'll,
But-
whoever's, yeah.
He's retired, but I think that would be wonderful. What do you think?
I think you did good.
I think it's a good idea,
Yes.
just to explore if there's more we can do than a lot of questions that I've been getting regarding what's going on with the mosquitoes and
Yeah, and-
uptick in certain things, and people have truly reached out to me, and I don't usually get questions.
When you hear about the spraying from the state, like they had with Triple E, when the state says we're gonna do mosquito spraying for Triple E.
Right.
That's very different from the East Middlesex Mosquito Control Projects and the paying in money and that type of thing. So the state does their own surveillance, and they work with the mosquito control commissions, and they're looking at, how many people have gotten Triple E, how many animals have gotten it. And then they make a decision that we're gonna do spraying in certain areas, but their spraying is very different. It's plain spraying. It's for aerial spraying, which is different from the truck mounted spraying. So they only do that when, there's high levels or real reason to believe in these areas, we need that aerial spraying. And that is all paid for by the state, not by individual communities. Communities pay into these mosquito control commissions, but not for that aerial type of spraying, which is decided upon by state officials.
Right.
How long have we been doing the program that we're in right now, what we pay for? Has it been 5 years? It hasn't changed?
It usually, what happens is, it goes up because inflation, we haven't had an increase, we've had the same level of services for many years. The one thing that I know of that could, when they say, when they come to talk, they might mention doing stream cleaning type of things, where they take, use machinery to take large things out of streams. But that is not something that our Conservation Commission wants or would allow, is my understanding, because they don't want any machinery going into the streams. So that is a service that they provide, but it's not something that we've had here. So we've kept really the same services, which includes larvicide. You could probably pay for more catch basins or something. But that's basically what they do. They helicopter, they do the catch basins, they do the truck-mounted spraying and the surveillance. And as far as the surveillance goes, I don't know, if increasing, how they would make that decision.
And as you know, it's a two-edged sword because we have beekeepers in town.
I
And
understand.
they have called me because their hives have been wiped out in some of these cases.
And there's
So-
nothing against the bees,
Yeah,
but
yeah. And then we have other
There's more
individuals
things, yeah.
who are allergic to the spray.
Correct.
And we have, so yeah, I would love to, I think the board has a great
Yeah.
idea. And then we can ask all these questions, I think, and have that person possibly join us that evening and hear about this, because it is a complicated issue.
Right. And I don't think we've ever actually, in my time anyways, I've ever had anybody from the Mosquito Control Commission come here and talk. So it would be a good thing for them to explain, you know, how it works, because the Mosquito Control Commissions are very, it's been this way for a very long time. And I know, I don't know, a year or so ago, I gave a presentation to the board on the proposed changes to mosquito control in Massachusetts.
Correct.
Because there's, when it comes to pesticide, there's, you know,
A lot.
it has to go by the regulations, right? So they were talking about changing those regulations and how they do it. I haven't heard anything about that happening. So I was hoping that would happen, because the problem with the mosquito control commissions, I think, is that cities and towns opt in to be in this mosquito control commission. But if you have a city and town that says, well, I can't afford it, they don't opt in, then there's no mosquito spraying happening in their town. And if you're a town right next to them, like, the mosquitoes don't know the boundaries, right?
correct.
So that's one of the problems with the mosquito control commissions. And the other thing that, you know, I'm not sure everybody's paying in the same amount. So, you know, we're all paying into it, but how much is this town paying in versus this? That I don't know. That would be a good thing for them to
But
kind of try to explain.
different towns getting different services because they're paying more.
They are,
And
but
what
the
are the
thing is,
services?
there's
Well,
only
that
a
could be
certain
based on
amount of
geography too,
services.
yeah.
Right.
You know, it's probably
True.
based on space.
Right, if you have a really large, like,
Yeah.
wetland area that needs larviciding, which we don't, you know, it's gonna take up more resources, you know?
Right, that makes sense.
So that's also what varies, and if you're getting the stream cleaning, and if you have more catch basins, or, there's a lot of things that go into it too, you know? But yeah, I'll have Christine reach out to them and see if we can get them in here to answer those questions.
And if we get prior to our
Prior to
budget.
budget.
Prior to budget
Yeah.
time.
Yeah, we definitely, sooner is better than later, because you might wanna talk about if you do want to change
Make a
it, because
change, we'd need time.
you're gonna have to defend that, you know, at town meeting and all that, if you're gonna increase the budget on that.
So we have 5 meetings left for the year. I counted them. So maybe one of those 5 meetings.
Yeah, we'll see when but hopefully, I mean, I think once we get the weather gets cooler, it'll die down for them. They're really busy
Of
right
course.
now, but, you know, maybe we can get them, probably, wintertime is the best time to get them in.
Great,
Yeah.
that'd be nice, thank you.
Any other questions? I just have 2 you could put it. I don't think you can answer these. She noted about the Northeastern University bunker structural integrity inspections that she, and I don't expect, you know, that's pretty clear. It's her area to give us an update on that. And the other is, would you say something about Household Hazardous Waste Day? It's coming up this Saturday from
Yes.
8:30 until noon. At 12:01 in the afternoon, we won't take your material. But specifically, I was going to ask her about fire extinguishers and flares. Do you have any back?
So we do not take flares, and we are not taking fire extinguishers. We will still be taking propane tanks.
Okay. Any other questions? If not, could I have a motion, please, to approve the environmental engineer's report?
Motion approved.
I have a motion by Andrea Sheehan, second by Marwa El Sabahi. All in favor?
Aye.
Aye, 500. The health agent's report, which is Marlene Johnson, and if we will, would you please also handle any questions from the Associate Health Inspector, Samantha Hardy?
Sure.
So let's go to Samantha Hardy's first. I have no questions. Does anybody else? Okay, so,
I have one. Oh, I'm sorry, were
This
you
is
talking about?
just Samantha Hardy's, the
first?
associate.
Okay.
Now we're going to go to the health agent. Ms. Johnson, any questions? Do you have anything to?
Yes, so I just wanted to, just to update the board. So September is National Food Safety Education Month. So we have a table on display across from our office, and I'd like to invite citizens. You still have one more week before we take it down, so please stop by our office. We are open till 7 o'clock on Wednesday. We have a lot of great food safety education material, some brochures. We have some magnets that you can put on your refrigerator with cooking temperatures, and we also have a hand washing travel dry soap that you just add water to that you can stick in your pocketbook. So please come by and take a look at our table and take some of the freebies that we have there. And then I wanted to let the board know that we've had a lot of inspections. We've had a lot of mobile food establishments come looking for permits, as well as a lot of temporary food applications come in. There's been a lot of events. There was Truck Day, Diwali's coming up, Taste of Burlington, there's about 24 applicants with that. And then with the mobile food establishments, there's in October, Trucktober. So it's been keeping our office busy with those. And we started the food permit renewals, a little over 200 permit renewals went out to the food establishment. So all the permits expire November 1st.
Questions? Did you have?
No, we don't usually see a lot of the foodborne illnesses on your report, and yours did too. It just seems high. I don't see a lot of that on your report.
We have, restaurants do a good job
Yeah.
with food safety. And, a lot of times too, people will call and they'll claim that they got sick, and they have, they call it last restaurant bias. It's not always the last place that you ate that made you sick. It could have been something that you had 2 days before. If you're talking about Campylobacter, that can be 2 to 5 days before. But we look into all of the complaints that come in.
Thank you.
You're welcome.
Any questions? So you had 9 re-inspections. Everybody was in compliance.
Yes.
Shaw's, they've done a very nice job with their remodel, but they've been in contact with you.
They have, and I did a walkthrough recently over there just to see how they're coming along.
Okay, thank you. And just to note that I count your correspondence and your inspections or whatever over the last couple of weeks, 76, as you know. So thank you so
I
much.
keep busy, sure.
Thank you so much. If there's nothing else, do I have a motion to approve?
So moved.
I'm sorry, was that you?
Yes, yeah.
Ms. Welch, second by?
Second.
Second by Ms. Sheehan, all in favor?
Aye.
Aye, 500, which brings us to the Associate Director, Mr. Green.
Yeah, hello, Chair, Board. I'd like to bring to the attention the Carfit event at Leahy this weekend. It's going to be running from 9:30 to 1 p.m. So once folks are done dropping off their household hazardous waste and they sign up for the Carfit event, this is a program we do in collaboration with Leahy Hospital, and it was developed between, I think it was Maine Health, AAA, AARP, and it's a program for seniors to fit their vehicle better to them, especially with the new technologies and changes as we get older, both in our physical structure and our reaction times, maybe our sight, changing how the vehicle fits us to better accommodate those changes, usually make it a little bit safer. So if anyone's interested, they can certainly reach out to the Board of Health and we can get them signed up for that program.
Questions for Mr. Green?
A quick question, is this to actually help people choose their vehicle, or how does this work?
Nope, this is actually to help them fit their current vehicle better to them. So we've had some instances where people have had a vehicle for a really long time, and the vehicle pretty much stays the same, but they've changed. So making adjustments to better fit them is good for them. And then other folks have shown up with newer vehicles that they didn't know there were a bunch of safety features that they could turn on. So that's another benefit to the program.
Yeah, pretty cool. Any other questions? All right, comments? Well, you've been very busy with the BVRC. You had a quarterly meeting with the speaker, executive meeting, steering committee, leader forum. You've been very busy, so thank you very much. And the psychological first aid program was absolutely magnificent, and I hope you please would send a note to Doctors Khan and Moorhead Slaughter. I thought they were magnificent. They really were good. If you'd like me to reach out to them, I will, but I thought their program was extra special. And
I agree, that was a fantastic program.
really was.
Really impactful.
so we may possibly have them again. They were very good. So with that, I have nothing else to comment on. So do I have a motion to approve the Associate Director of Public Health report?
Motion to approve.
So I have Dr. Mara El Sabahi, second by Andrew Sheehan. All in favor?
Aye.
500. And last, we have the Director of Public Health, Ms. Luminello, and I'd like to include that, the supervisory nurse, which is Sandy Triani. And so why don't we ask first, is there anything you'd like to ask about the supervisory nurse?
Will I be able to meet her
Yeah, we're gonna bring her in?
Yeah,
October 5th?
October, she'll be, so our flu clinic is October 5th. We have some, we already had a flu clinic, high-dose clinic for seniors last week, and she gave up around 50 doses, so we have some doses left for the October 5th clinic, so she'll be there. Anybody who wants a vaccine, please come into or let us know, come into the office. She's doing the emergency responders now in the office. And she's working on the Vaccine for Children program. She's been giving out vaccines through that program as well. We've gotten quite a few now new students from the schools, not as many as we had last year, but we've been going back to the established students, the students who've been in the schools. We did most of them over the summer, so it's a little slower, but she's had a few students that she's just having them come into the office, which is a lot easier than holding the larger clinics at the schools, which we had to do last year. So that's working out really well as well. So
And where is the October clinic gonna take place?
Grandview Farm, and people can sign up on our website, so we'd like everybody to make an appointment ahead of time to make sure that we have the vaccine for them. So if they go to our website, we have a link for a regular dose and a link for a high dose. High dose is for those 65 plus.
Okay, good.
And the high dose is a limited amount, regular dose, quite a few doses still. And I just want to make a comment too on Mike's report, if I could, with the CARFIT. Mike's been doing a great job with the CARFIT. He's been working really hard. He didn't mention that he's a trained technician as well. So he can go through and, tell someone how to adjust their car to fit them. He's been working with the MRC. So we have some MRC volunteers who are interested in becoming trained technicians, and he's trying to get it up and running. Hopefully, the goal would be to have it at our building, the senior center, so that, Mike can run that with our volunteers and have them drive up to the senior center and do the same thing for them there. One of the problems that he's run into is you need an occupational therapist, or you should have or you can have an occupational therapist there. So we don't have any volunteers who are occupational therapists, but if we had one, we could get them trained hopefully on the CARFIT thing. So that's kind of but the ultimate goal is to kind of have Mike run it at our building with the MRC, and so that we can offer it on a regular basis as well.
That is really neat, actually. Is there a lot of demand? I mean, do you find a lot of demand for
In different areas, there's more demand. So we had trainers or coordinators contact us from Florida. I guess it's
Oh, wow.
very, very popular in Florida. It's offered all over the place. So we're really trying to get it going here. We actually had people from New Hampshire and Maine come down to Burlington last year for some technician training. I actually recently got event coordinator trained. So kind of that next level, so I can start putting everything together. They open up all the resources to you on the website, and actually, Deb wasn't able to make it due to a family emergency, so Jared, one of the other coordinators, and I actually headed up the training last week. So, yeah, I'm really excited to pull that program in-house and be able to offer it, because I think the COA parking lot space would be very conducive to this program.
Just need an OT to join the reserve.
I'd like an OT.
No, I'm thinking like,
Yeah.
do I know, or,
There are a few at Leahy that said, I could poach their services and they wouldn't mind coming out, or they could even do a virtual consultation for somebody. So if we did the checkup and the final checklist is where the OT goes over kind of any issues that we can't resolve with adjustments to the car, there's other products that they might be able to use, that's where the OT would come in. So we could lean on them to have them, reach out and get that information, so.
And again, what is that date? That is this coming Saturday?
That is this coming Saturday, 9:30 to 1. And please reach out to us so that we can coordinate that. Because if we have a bunch of people showing up, we might actually overwhelm the services we have. So usually it's very structured. We kind of give them a 20, 30-minute time frame to come and get their checkup in.
Thank you. And also under the nurse, please thank her for checking all the AEDs.
Yes,
I know that's a lot of work.
yeah, she does that on a monthly basis.
Oh, a month?
Oh, I didn't know that.
I didn't know. Okay, good.
I just had a quick question regarding 4 Wildwood Street. It says there was a letter, and I don't know if there was any further updates since the gentleman came in, or the
No, no,
landlord came in.
we're on the nurse's report.
Oh, I'm sorry.
okay, all right.
I'm sorry. I was just getting ahead of that.
Let's transition.
Yeah, no,
Let's
I
tra-
apologize.
No, let's transition now to Director of Public Health.
Yeah.
Please, Ms. Sheehan, go ahead.
I was right with you.
Oh, I'm sorry, I was just like,
I was just
yeah,
confused.
no, that's, okay, because I was,
We haven't heard from him. I think we gave him, I can't remember the date that we
It
gave
was
him.
November or something.
November.
November, okay.
yeah, no, that's why, when I saw it, I said, I was just wondering about that.
Yeah, haven't heard anything either way.
Yep.
But once we get closer to the board meeting, we'll reach out to him again.
Okay.
Yeah. With my report, I mentioned are we on my, yeah.
Yes.
I mentioned I don't know if there's any other questions.
I have some questions.
Okay.
But I don't know if you want to go over your report first.
No, go ahead.
It was just about the nicotine-free.
Yeah, that's what I
You
wanted
want to talk about it?
mention.
Okay.
I just wanted to make the board aware. We got this letter that came in, the letter from
Who was the letter from? I don't
this
know that
New
person.
England Convenience Store
Yeah.
and Marketers Association.
So are they
They sent the letter to
a
BOA.
lobbyist?
Well, they have a certain opinion on it, right? They're on the side of the convenience store owners, right? And they sent this letter to us and to the board and asked us to share it with the board, so that's why I put it in my report. You also may have seen that it's been in the news lately. I put in this article here from Boston.com about what cities and towns have done this. It's being called the nicotine-free generation, and basically what it is in your regulations, the tobacco regulations, you would put, basically it's just a small section that you wouldn't be able to buy tobacco products if you were born before a certain year. So that's what this is, and, I guess the idea is eventually you're gonna have a whole, because they're not buying it and hopefully not starting it, you would have a whole generation of people who can't buy tobacco. So I don't know if we want to have a whole discussion on everything about it, but I know it's been in the news, and I don't know if the board wants to discuss this. I know Lexington has discussed it, and that was in the news like last week or so. if you do put it on your agenda, I would expect there would be a lot of people interested in discussing it with you, if this is something that you want to put on the agenda, but I just wanted to make you aware of, if you're seeing it in the news, this is what it is.
I mean, I would assume this would come up at some point as the point of contention if there are other towns that are voting on this or thinking. I think Lexington put it off, though. I think they put off making a decision, is that correct?
Yeah, I think that they wanted to really, the purpose of their meeting was just to gather information on
Right,
it.
right, exactly.
And it ended up being portrayed, I think, in a different way, that they were gonna make a decision, I think, in the news, but I don't,
I mean, I'm curious about learning more about it. I didn't understand that if you were born before this date, you can never buy.
That's
Like,
what it
once you
is.
turn 21, you don't, like, I just thought the clock changed and convenience stores would have to revise their
It's very
practices a little
controversial.
bit.
It's very
It is.
controversial. Because
So this is it.
alcohol next,
Yeah.
marijuana
You pick a
next.
date and that's it.
Yeah.
yeah, and there's different dates.
Oh.
Because it
I didn't
depends
know
on
it was
when
that strict.
a specific board enacted it. So, like, was the first town who did it, I think it was Brockton or Brookline or?
Brookline.
Brookline was the first town, so their date is different from somebody who would adopt it now. So the date kind of changes,
Confusing.
you know?
So they did it.
They look like they rejected it.
Brookline did adopt it.
So Brookline
It
did
says
it,
NFG here.
I know, that's.
I
what was
looked it up.
confused.
Yeah,
That was wrong,
Brookline
because
was-
I know.
Okay,
it was the first one. and
documentation.
Yeah, let's,
That's the one that went to court. So it was upheld in court. And I don't know if it's maybe going back again or looking for appeal. I don't know. I don't know what the legal aspect of it is currently now, but I do know that Brookline went and then they were taken to court
I see.
and it was upheld.
They're just-
And then after them, then the additional cities and
please,
towns.
through the chair.
So, I mean, I think there's a lot of boards or the expectation is boards will be discussing this or some boards have discussed it, you know.
I guess I would like at some point to have a better understanding of it, but I don't
So
know.
we
If
could,
that's my own personal thing, I can do it on my own.
yeah, I mean, I guess the board would need to decide if you want to put it on as an agenda
An agenda
item
item
for
at some point.
discussion, you know. And then if that was the case, we would have, I would have, try to contact some other people to come in on.
Of course.
either way, and, you
You
know.
can decide. Think about it. It's up to you. Is there anything else for the Director of Public Health? Just welcome back.
Thank you.
And, she was on vacation in Hawaii.
Very nice.
Did you go Hawaii?
Good came back.
What are you, crazy?
I made her.
So if there's nothing else, we have one question. We're looking for a clerk, a part-time clerk?
Yeah, administrative assistant, yeah.
Is that what they're calling that?
Yes.
Miss? And we're looking for a recording secretary?
No, Julie is only on maternity leave.
Oh, okay.
Yeah,
So
and
she-
actually, she's doing it from home.
So she's not going to be
So-
leaving us?
So no, thank you.
Oh, that's wonderful.
okay.
Oh, that's, okay.
But we, in the shared services office, there's part-time nurse opening, and we did hire somebody for the health communication position.
Oh, great.
And you're on the subcommittee for the
Yes.
administrative assistant?
Yes.
Yes, great. Oh, if that's it, do I have a motion to approve the Director of Public Health report?
So moved.
Second.
Motion by Ms. Welch, second by Ms. Jean. All in favor?
Aye.
Well, I guess that, so, everybody,
Good night.
welcome to the Jewish New Year. I should say Happy Jewish New Year. Prosperous and healthy Diwali, which is this Sunday on the Common. And with that, do I have a motion to adjourn?
Motion.
Do a second? Second, all in favor? Aye. Good night, everybody.
Good night.
Aye.